sustain that, what would be your position as governor on the private option that we passed earlier in the Arkansas legislature?
Well, I'm not dancing around it, and I'll be very clear with you. I would have voted for it, I would have signed it, and as governor, I'll protect funding for the Medicaid expansion, the so-called private option here in Arkansas. Let me tell you why. And I know I got crossways with some of you folks when I was in Congress because I voted against the Affordable Care Act. I did. I decided I want you to believe I voted for it and I'm responsible for it, so go figure. But at the time, I said there's good parts and there's bad parts. In the Medicaid expansion, the public option, I believe, is a part that makes a lot of sense. Number one, what Governor Beebe, a Democrat, and a Republican legislature did by working together in a bipartisan manner was so creative, so innovative, so different that we had to go to the federal government and get a waiver to be able to implement it. That's how far removed it is from the Affordable Care Act, number one. Number two, it is the only part of the Affordable Care Act that the states have any say over. Number three, the Affordable Care Act, which is one of the reasons I voted against it, it did cut Medicare reimbursement rates to hospitals. It did. That's how they helped pay for it. But here's what they said. They said the Medicaid expansion, the private option, is going to allow those hospitals to be made whole again because they'll start getting paid to treat patients that they were having to write off and treat for free. And in these deep southern states that are refusing to take the new Medicaid dollars just because they're mad at the president or mad at Washington or for whatever reason they're giving today, to me that makes as much sense as turning down our federal highway turnback funds that we pay into every time we fill up at the gas pump. And that's why all the hospitals in Arkansas are adamantly in support of this, because it's their lifeline. They've been cut in their Medicare reimbursement rates. This helps make them whole again. And it's a big number. I mean, I think in Forest City, it's something like about $900,000 a year. That's a lot to the little hospital in St. Francis County. It really will make a difference of whether some of these hospitals survive or not. And I tell you, it's very important to me, and it's personal to me, because we lost the hospital in my home county back in the mid-90s. I don't wish that on anybody. We're one of the last hospitals in Arkansas closed before they came up with a critical access designation, which has helped save all the hospitals in this state, in this country, for the most part, ever since. And then, as you were driving here today, it saves the state about $89 million a year. A lot of people don't understand that. And when you were driving here today, you didn't see diseased, sick people laying in the ditches. We have uncompensated care programs. We'll no longer need to fund those programs through the Medicaid expansion, the private option. So, so from a fiscal standpoint, from helping save our hospitals, it makes a lot of sense to me. But here's the biggest reason why I support it. And I hear people all the time tell me, well, I'm against it because I don't want my tax money going to provide health insurance for people going to work. Guess what? They already did it. They're part of traditional Medicaid. This Medicaid expansion, this private option, is about providing health care to the people that are trying to do the right thing and stay off welfare, but they're working the jobs with no benefits. I was talking about this at an event the other night, and the catering folks that were there, a woman came up to me that was with the catering company at the end, and she said, "You were talking about me." And with tears in her eyes, she said, "I'm a college graduate. I've got 2 jobs, 2 kids at home. And this private option is the first time I've had health insurance since my husband left me." That's what I'm talking about. And I think, as a Christian, I think it's the right thing to do, and I'm going to do my best as governor to make sure that we